Hello everyone. In this video we're going to discuss Chapter 8, the topic of which is social support. This means friends, family, caregivers of all kind, including hospice care and end-of-life care. Not the most uplifting topic, but there's a lot of important reminders in here that have implications for our mental and physical health and well-being. So let's get into it and see if we can glean some useful lessons for ourselves. Now, I would like to begin this discussion with a consideration of the relationship between physical or physiological health and psychological health, and just these different states. These two aspects of our existence are interrelated, and they have a recursive relationship. So let's consider, again, before we get into it, the WHO definition. This is going all the way back to 1948, right? And they argued that health should be defined as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Now, whether or not we think this is a realistic goal, I think we could probably take out the complete and then maybe have a more realistic goal to meet here. But this definition is consistently used, and we use it for a specific reason, and that's because it's emphasizing that we're not just talking about the absence of symptoms of illness. When we talk about health, we're talking about something else. Two, we're talking about our mental health and well-being. That we have been not very quick to recognize that in Western culture. So this can be a little bit of a problem, and we're going to see some examples of that as we go throughout. The easiest example is the stigmas around mental health and mental illness in the West. And regardless of how you feel about this, we need to at least acknowledge that our mental health is important too. Whether or not you think people should be going to therapy or doing it themselves, we can probably all agree that our mood is really important. And there's a reason for that. We can't separate the two. So a lot of this lecture and a lot of the topics of social support are going to focus on, well, they're gonna rely on dynamics that we refer to as dialectics. Dialectical tensions mean two things exist uh, kind of in contradiction, but also in balance and necessarily exist at the same time. This could be things like individualism and collectivism, right? There's always a tension between the individual self and the social self, the societal self, that it branches out beyond who we are and where the boundaries of our skin lie. That's a dialectical tension as well. We are an individual, but we are multiple, right? And Americans are a great example of this. Traditionally, we're viewed as a very individualistic society, but we can be quite collectivistic at times as well, particularly when it comes to things like patriotism. So these are dialectics, and much like those dialectics, the physical and physiological versus psychological kind of dialectic, well, we can't really separate the two out. They both go hand in hand. And so I want to start this lecture by recognizing the importance between this relationship of our physiological and psychological well-being. So you have these two things, and they exist in a recursive relationship, in a cycle, in a dialectical tension, call it what you will. But what we want to recognize is that they do exist in this relationship. So, for example, if you are feeling psychological distress, you are also probably going to have a heightened physiological state, more cortisol released, tensed muscles, reduction in digestive activity, all those things. Maybe you learned about that in public speaking, right? The fight or flight response. You get up on stage and you see everyone and it starts freaking out. It gets harder to speak because your muscles tense up. Your mouth goes dry because your saliva production stops. Your heart rate increases because cortisol levels increase because of that heightened psychological state of arousal. And then that feeds into that mood all the way around. So we create this kind of cycle. Likewise, we can have physical exercise is going to release all kinds of endorphins and things along those lines. That's going to feed into a heightened sense of well-being just by being physically active. So we can see this relationship feeding into these two factors going back and forth. And that sounds kind of scary in some ways, right? Because you can have a problem. You can spiral. You can all right, you can freak yourself out, you have anxiety, you start feeling more anxious, and then you just keep going around and around and around, and here we go, a nice little red, scary, very scary spiral. But on the bright side, that also means that we can step into this cycle at any point. We can interrupt the relationship between psychological and physiological activity, such as with breathing exercises. So that's the good news here, right? When you have a recursive relationship like this, it may seem hopeless because it's all so interconnected, but everything is interconnected and interdependent. It's really a matter of where we can exert our influence. And this is a good example of one of those kinds of relationships where we can do that. So what are some examples of this relationship? Well, there's a good one in what we call facial feedback, and this would be smiling more, laughing more. This can improve your mood, not just you're smiling and laughing because you're in a good mood. That feeds into it. You can have this kind of facial feedback in that way. Likewise, if you're frowning a lot, you may not be in such a good mood. It's kind of a chicken and egg situation where we can consider, well, which came first, the smile or the good mood? Well, sometimes it doesn't matter. This isn't an excuse, of course, to just grin and bear it and ignore all your emotions. That's not what we're talking about here. But what we are talking about are some real physiological consequences to affective displays. Another example would be breathing. So sighing can be a problem or a good thing. It is appropriate to take deep breaths periodically to reset your breathing. However, if you're taking deep breaths or sighing more than every 20 minutes, that could be a problem, and it can actually depress your mood as well. That's a physiological feedback here. Really, any kind of breathing exercise will have a similar effect. And I always like to share there's a Japanese expression that translates directly to sighing is your happiness running away. It seems a little on the nose when you say it in English, but you get the idea here. And there is some research to support that. So the Japanese are a little bit more repressive society. They condone emotional expression in certain contexts and lots more emotional repression in other contexts. That's a separate matter, though. The same principle applies here. But breathing, if you've ever done meditation, you'd be familiar with that as well. So meditation, meditative breathing exercises, that can be helpful. Box breathing. There are lots of recommendations for this, so we don't need to go into that. But likewise, exercise can help with this as well. If you are just exercising regularly, my favorite exercise is swimming laps, because it has this meditative aspect to it of monitoring your breathing and controlling your breathing. And really, breathing is a great example of this relationship in general. If you remember all the way back to middle school when you learned about voluntary and involuntary muscle movements, well, breathing, is it voluntary or involuntary, right? You will do it even if you're unconscious or asleep, but you do have some control over it as well. And that's great. If you impose control over your breathing, you can reset your vagal tone. It takes about, let's see, what was it, 13 deep breaths, I believe. That's a long time when you're focused on it, over a minute, but that will actually reset your vagal tone, which is the relationship between your brain and your heart, and controlling that rhythm. So you can actually adjust that by doing deep breathing exercises. So it's a great example of this relationship. We also have drug use. That's an interesting category we could talk about, and we'll get into this a little bit more when we get to transcendent experiences. And you can think about this in terms of therapeutic drug use or recreational drug use or damaging drug use. And like everything else, you can see a lot of good and bad things going on there. But there are therapeutic applications of psychedelic substances that can induce transcendent states that make people feel better about their lives. There's a lot of research happening with this right now, with psychedelic therapy, basically, which doesn't require habitual use. It could be a one-time thing. They give a patient with severe anxiety a psychoactive substance, induce kind of a transcendent dissociative state, and that allows their brain to kind of circumvent some pathways that have already been built there. So but there's a psychological state associated with that process and an experience involved there as well. We don't have to go too much further on this, but it's really important to establish this connection between physiological and psychological states and health. Because when we get into social support, we are recognizing the basic fact that people aren't just feeling icky or good. People aren't just like, hey, I hurt, I'm going to take ibuprofen and that makes everything better. Chronic illness is not just about chronic pain. There is also a depression component tied up in these that people have to deal with. And social support is one of the most important ways that we deal with that, because these are our social networks. So let's explore that a little bit deeper. As we move on to discuss social support, we'd be remiss not to mention the role of families. And as kind of a transition here, we can consider this in relation to culture, because families and what they look different in different cultures. So I mentioned at the top of the lecture, individualism versus collectivism. Family is a good indication of that, because in a society like ours, well, families are important, but we tend to, as a society, prioritize the individual in terms of the decisions that they make and the actions that they take every single day. So it would not be unusual in Western society to leave your job for a new one, right? Continue to pursue your career, and that's all about you and doing your own thing. This is a Western manifestation of that individual expression, the independence, and self-sufficiency. Now, that doesn't mean that countries like Japan don't have a sense of that. But what it means is that those societies tend to prioritize not just individual well-being, but their social groups in terms of there's a lot of pressure to, for instance, stay with the job that you have. So people are lifelong career people, and it's very unusual to change careers partway through your life, as it were, right? That's part of your family as well. You also see collectivism manifest in the sense of pride, parental pride, for instance. If your child is a doctor, that's almost as good as you being a doctor, right? With the respect that that commands and how important that is. So these things manifest a little bit differently. Now, that doesn't mean family is not important in every country and every culture, but we do want to recognize, at least from a healthcare sense, that people are coming from a lot of different cultural backgrounds, particularly here in the United States. So a lot of cultures have multi-generational families under the same roof. That's not as common with, say, American culture, or at least white American culture. It's mostly the nuclear family, parents and children. However, in Latino culture, it's not unusual to have the grandparents living there. In Japanese culture, it's not unusual to have the whole family living under one roof. So family matters, even if you don't like them, and especially if you don't like them, it matters, because this impacts how you grew up. It impacts a lot of things about you. And the Task Force on the Family from the American Academy of Pediatrics, way back in 2003, one of their conclusions in this report that they made was that it's clear that children's outcomes, physical and emotional health, and their cognitive and social functioning are strongly influenced by how well their families function. So also in this report was the recommendation that doctors familiarize themselves, pediatricians familiarize themselves with the family structure that they have at home, including if it's a single parent household, the doctors should also encourage the non-custodial parent to be involved in that child's life and health. The research shows a lot of things on this, and while this study is a little bit dated, those findings have held pretty true. And by those findings, I mean family is better than no family for children and their development and their outcomes. So single parent households do have additional challenges, and it is better to have two parents rather than one. There's a whole other body of research we can talk about here, but that's probably enough for now. Suffice to say, it is a well-recognized phenomenon that children's families are critical to their development and upbringing. And that's true regardless of our culture and regardless of how many generations we have under one roof. Still, different cultures prioritize the family unit differently. Now, that is just another argument for more individualized care, getting to know the patients, getting to know their families, and trying to encourage those natural dynamics that already exist in our social support. Now, family is just one domain of social support, but it's not the only source of social support. It's probably the most obvious example to go to. Because again, even if you don't like your family, they play a critical role in how you've grown up and how you experience your life, regardless of how much you like them. Perhaps we all have family members that we don't like a whole lot, but we still love them anyway. Even if you have siblings that you don't get along with, those, as I mentioned before when talking about things like co-registration and shared lived experience of identifiable groups, growing up with a sibling, they have seen a lot of the same stuff that you have. They've gone through a lot of the same stuff that you have. And that makes a huge difference in terms of how you view the world and how you view yourself. What is social support? Now that we've kind of gotten some examples out of the way and are orienting ourselves to this idea? Well, social support, at least as defined by our textbook, coming from Barnes and Duck, 1994, is that we're talking about behaviors that, whether directly or indirectly, communicate to an individual that they are valued and cared for by others. So the measurement here is not necessarily like a quantitative amount of help being offered or qualitative. What we're talking about is enough help that it creates the sense that people care about you, right? And whoever you are, there are probably people who care about you. And even if you feel like that's not true, which would be very tragic, but I still don't think it's likely. But even if you feel that way, we can use this as a reminder that we do need our social relationships. And so part of our health and well-being is cultivating healthy, positive relationships and having people that we can trust and depend on. Now, people do best in difficult situations when they feel informed, when they feel involved, and when they feel cared for. Social support tends to matter more in stressful situations, but it also matters when we're not under stress because we know that we're going to have people in our corner backing us up when it comes down to it. This is called the buffering hypothesis that the textbook is introducing for you. Hypothesis because it's more just an idea rather than something that's been measured. There's lots of research on social support though. Don't worry about that nomenclature here so much as recognizing the fact that having strong social support means that we're going to do better in stressful situations. Thus, our social networks and our loved ones buffer us from the harm and stress of stressful situations. The textbook does a good job of exploring how social ties and health are linked. Right? Social ties are linked to good health, and this is in part because we are uniquely social animals. And I always love talking about this. I find the idea of our nature fascinating. We are successful as apex predators out in the world because of our social nature, because of our coordination in groups. We are able to form fairly large-scale groups, more so than many other mammals, and that allows us to coordinate our behavior. We also have unique symbol and language use that allows us to coordinate our behaviors rather precisely. Not in the way that like insects do, right? Bees following pheromones. It's a little bit different. And I think that's a good thing. The fact that we have to negotiate our reality, our social reality, maybe it would be easier if we were all telepathic and could just know what each other were thinking. But the fact that we are social animals and that we have to negotiate our reality, our social reality through language, well, that's kind of a, for lack of a better word, it's a magical thing. So in this, we recall the WHO health definition and know that it's not just physical health, there's the mental health as well. And that is tied with our social lives. Now, while we're on the topic of the WHO definition of health, keep in mind that they're not the first ones to say this in 1948. There are lots of different cultural perspectives on this. You may recall from the cultural perspectives the idea of balance. Well, of course, that's tied in here as well. There are also, I'm involved in some research with the Great Lakes Anishinaabe, looking at their concept of health, which they refer to as Mino Bimadaziwin. Let's see if I can pronounce that correctly. But that translates roughly to good living. Go figure. But it's made up of components, right? And many of those components, one of those four components is physiological health. The other ones have to do with being in touch with your community, being in touch with your family, being in touch with nature. And so this is not new. What's unique in the big picture of these health definitions would be the Western idea that physical health would somehow be separate from psychological health. But now, in our defense, we are moving away from that. But just in case we needed another reminder to connect these things together. But in terms of our social aspect and our uniquely social nature, we learn behaviors and gain confidence from our interactions with others. That could be our family, that could be our community, that could be our tribe, that could be whatever. But what we're talking about here is things like conflict styles, affective displays. These are learned from the family. So I can't help but talk about culture when I talk about family, because family is kind of the smallest unit of culture, of the transmission of culture. This is where the transmission of culture primarily occurs, is at home and also at school and things like that. But our conflict styles, we learn those from our parents. So if your parents are conflict avoidant, then you might have trouble dealing with conflict if you meet someone or have a significant other when you grow up who's a little more expressive in their conflict. That could be a problem for you. There's research showing that people who grow up in conflict avoidant households, for instance, have trouble negotiating safe sex practices, right? Such as telling your partner to use contraception. People who grew up in a context in which they are conflict avoidant will be less willing to have those kinds of conversations. So that's just one example of how this works. Affective displays work this way too, in terms of how we are expressing emotion, whether or not we are expressing emotion or whether or not we're repressing our emotions. That comes from the family as well. So this is one important way in which our social ties are linked with good health. Blood pressure, immunity, mood related to humor and affection. So if we are laughing, if we are having a good time, this impacts our actual physiological state, as I mentioned at the top of the lecture. The role of cortisol in this is a stress hormone, but having fun, relaxing, laughing, that helps reduce the levels of cortisol in our bloodstream. Just one physiological indicator of stress. There are other, of course, but you get the idea here. We already talked about that. So loved ones can also help support healthy decisions. You maybe you know that couples who go to the gym together and work out together are more likely to reach their workout goals. They're going to stick with it. They're going to be healthier. Hey, honey, I think I need to stop drinking so much. Hey, that's a great idea. I think I will do it too. And we'll do that together. I'm going to support you in that. Loved ones help us make those healthy decisions so that we don't feel so alone and that we can actually have the instrumental and affective support that we need. So speaking of instrumental and affective support, what kinds of support are there? Instrumental support means doing stuff for someone or freeing them up, right, to do other things. This is, taking chores off someone's plate, giving them a break from whatever they have to do, things like that, helping people out, doing them a favor. Affective support, in comparison, is providing comfort, whether it's emotional or something along those lines. So the textbook talks about nurturing support, which has three components: esteem support, in which we are helping someone to feel good about themselves; emotional support, in which we are helping them explore and express their emotions to reduce the emotional burden within them; and social networking, in which we are building outside relationships that can help us obtain more resources and engage with the world around us. Now, it's really important to recognize that different people have different support needs. There's some research into sex differences if you want to go down that route, but we've probably spent enough time talking about cliches like that, other than recognize that people do have different needs. Some people prefer instrumental support, some people prefer affective support. And sometimes that breaks along gender lines, but there's always exceptions to that. But for example, I think I'm a little bit more of an instrumental support person, and this is common with many American men, in that if I'm stressed out, I would like to do less stuff. I would like to have someone help me do the things that I need to do. My wife is much more into affective support. So if she's stressed out, she'd probably prefer some affection and a hug. But you get into trouble when we have different expectations, and she's stressed out, so I try to do things for her when really she just wants a hug, or vice versa. I'm stressed out because there's a bunch of stuff I need to do. She wants to give me affection, but I just want her to help me do the stuff, right? That's a difference of support needs. And so we want to recognize that people have different support needs, which can lead us to some healthy social support behaviors. So this can be a source of tension in relationships, of course, but there are ways to deal with this, and not everyone's prepared to do that. So hopefully by discussing this here, we can get a couple of tips and get going in the right direction to deal with these things in the future. Now, regardless of the kind of social support you need, a sense of agency is critical to mental wellness. Most of the things we're talking about are helping someone who's under a lot of stress feel like they have some control over their lives. So, for example, you may recall from the diversity chapter, we were talking about disability and illness. Having a disability does not make you want to be treated like you're helpless and can't do anything for yourself, right? It's nice to have support, but that's not always looking like people being overbearing and treating you like a child, right? People need to preserve a sense of agency to have, well, agency in their health and feel good about who they are and how they feel. People don't usually like feeling helpless. That is something that we want to keep in mind as we go through social support. The textbook has, if you go to the glossary of this chapter, there are a lot of words that begin with the word over, right? Over helping, over supporting, whatever it may be. That doesn't make people feel great, right? So sometimes we can do too much of this, and so it's important to follow the lead of the people who are in need of support. Social support is by definition talking about an external thing that we can do for someone else or they can do for us, but it is, of course, related to coping and communication. Coping being what we do for ourselves and how we handle stressful situations. First, we kind of need to recognize that people need to work through their problems, not just ignore them. We've mentioned that several times throughout the course, and it's no different here. It's always worth remembering that trying to ignore our problems does not make them go away. So we have to deal with them in some kind of way, and there are different ways of doing that. The impulse may be to do the latter here, to ignore our problems. This is not unusual. This is fairly common because problems make us uncomfortable. Uncertainty makes us uncomfortable, and we don't like to feel uncomfortable. So we have to figure out healthy ways to deal with our problems. Some people do this and some people don't. But the point to recognize here is that even if people seem like they're doing okay, they may not be doing all that okay in stressful situations. Right? Putting on a happy, brave face or whatever it may be, they may still need to talk about things. That doesn't mean you should dig and prod until they talk about things. It means that we should be responsive and we should encourage people where able. But we do need to follow the lead of people who are going through crisis or suffering. So you should let the distress set the tone when it comes to stuff like this. We just want to recognize they may still need to talk even if they don't act like it. Coping defines or describes how we respond to stressful situations. We do this in a couple of different ways. We are able to problem solve, which means changing things that we can change, and we can emotionally adjust, which means adapting to what we can't change. Now, crisis, the definition of this would be when a stressor exceeds our normal coping abilities. You can imagine a great deal of stressful situations, and when we are in crisis, there are some major consequences to that. Usually, if our stressful situation is exceeding our normal coping ability, that's when social support becomes the most important. We are dealing with feelings such as, wow, things are never going to be the same again, which may be true, but it's not the end of the world when that happens. We just have to renegotiate our new normal. Going back to the idea of dialectics, agency and uncertainty is another one. This is the common theme here throughout this video, and we're talking about social support and coping in general. When we feel uncertain, we feel like we have less control over things, and vice versa. If we feel like we have less control over things, we feel less certain. So reducing our uncertainty can help us increase our agency. Crisis often results in renegotiating what normal means for us. So we need to recognize and forgive ourselves for a couple things. One, speaking of engaging with our emotions rather than ignoring them, all we really mean when we say that is to recognize them, acknowledge them. It's okay to feel afraid. And if you're feeling afraid, you can at least start with that rather than try and suppress that because it almost never works. Acknowledging that you feel afraid is the first step to not feeling afraid. And when we get down to it, you've got enough to worry about in a stressful situation without worrying about worrying. And I know you know what I'm talking about. This happens all the time. I do it to myself. I'll start worrying and then I'll be like, why am I worrying about this? This is a problem that I can fix, or it's not that big of a deal at all. And then I feel bad about feeling bad. And then you can go all day or stay up all night worrying about things that you're worrying about, or worrying about those things. We don't want to do that. And the first step to avoiding it is trying to recognize that it's okay to have emotions. Feeling afraid is not the worst thing in the world, but you need to acknowledge it. Sharing your concerns with your providers is another useful tip here that can help us increase our agency. If we're feeling helpless in a crisis situation, that can be a good way to do this. Sharing your concerns with your provider helps you get more information, they can help monitor your condition, and they can offer you reassurance. One of the lessons I've taken away from my ongoing work in a breast cancer work group for southeastern Wisconsin is talking to survivors there. They say, well, I went and had the mammograms all the time, so I was used to that. But once I actually had a cancer diagnosis, I realized how little I knew. And I didn't even know how to start getting that information. Well, starting with your provider is a great place because you don't know what you don't know until you know it. And you don't know you need to know it until you need to know it. I know that's a little confusing. I think you understand what I'm getting at anyway, though. Additionally, when we're negotiating a new normal, we need to take care of ourselves. That is essential. It's essential to restoring a sense of control. So we're talking about a little bit of self-care here. Now, self-care doesn't mean indulgence in the colloquial, Instagram sense. That can be a part of it at times, but self-care means taking control of what you can take control of. Take a shower, clean up your room, go exercise. Yes, maybe go with your loved ones, the people who truly play a role in your social support. Go have a drink with them, talk things out. But we probably shouldn't just sit around eating candy, watching Netflix, and like binge drinking. Right? These things do not increase your sense of control. Taking care of yourself does. Focus on your mental and physical health. Both of these things are essential, as we've discussed before, and you cannot have one without the other. Sorry. We would like to perhaps just ignore our emotions and just focus on the problems. I feel that way often. I'm kind of a problem solver. That's what I like to do. But if I can't solve the problem, I still have to deal with the emotional distress of the problem. And that's what we're talking about here. We need to resist the urge to push away support, but we should also be honest with our supporters in terms of what we need. We should be straightforward and honest with ourselves in what we need. And that will help us reach the best outcomes. What if you're on the other side of this? If you are in a position to support someone else, here are some useful activities or productive things that can help you be a better supportive listener on the left side of this table. And on the right are things that don't help so much. So supportive listeners will be attentive. That means actually listening to the person who's talking, not just forming opinions and trying to force them to see things your way. You have to listen to those people. It's helpful to be non-judgmental. That can be hard as well when you have strong opinions about a situation or a condition. But people, if we are trying to support our loved ones, they need to have agency. Again, that means that if we are judging or seem judging, that can remove agency from them, make them feel worse. Likewise, a role of emotional intelligence is important here, in which we can recognize, describe, identify emotions that we and others are feeling. One of the most important things a listener can do is help the person in distress articulate what they're feeling, because identifying our emotions does actually help us deal with them. It doesn't help us to just ignore them and have it burning in the back of your brain like some kind of weird little monster hiding behind your shoulder. We have to, in identifying them, we call them out, we bring them into the light of day. That helps. Supportive listeners are not going to be totally detached. You don't have to have no emotional responses if you're supportive. It's important to have your own emotions as well, but it's important to seem like you care about that person. If you're detached or cold, that doesn't help either. It's best not to be mocking, just jesting, within reason, right? Some people, that's their communication style, but we would need to recognize that when people are in distress, they may not take jokes as best as they used to. So just be aware of that. I expect you could use your common sense on that one. And it's also important not to be overbearing. That makes people feel helpless as well. Some people will try to help in every possible way as much as they possibly can, and that makes the other person feel helpless. And we've already talked about the role of learned helplessness in healthcare, whether it's hospice or nursing homes, something along those lines. If you feel helpless, you'll probably have worse outcomes. We need agency in order to have good outcomes and make good decisions in our own lives. So there is such a thing as too much support. For the remainder of the video, we're going to talk a little bit about well, end of life stuff, and hopefully we can put it into a perspective that's not just so sad. It's sad. These are hard things to talk about. There are three things that are taboo in almost every culture in the world. That would be death, excrement, and sex. So we're going to talk about death now, and that's really exciting. But it's important to do, right? This is another one of those things that Western culture has kind of avoided. American culture is not great about dealing with death, and we don't have a whole lot of practices built into our culture in terms of dealing with end-of-life care. And so it's important for us to consider this both personally, and if we ever have hopes of being professionals in the future in the health field, we're going to have to deal with this kind of stuff. Life's tough. Dying is not fun, but hey, death might be kind of easy. There's that at least. But all of these concepts, these things that we deal with, they raise the questions of spirituality and the role of spirituality in life. And this goes beyond just silly superstition. I think that people put a lot of energy into deriding religion and spirituality, particularly when they're young. As we age, we might renegotiate those kind of feelings. That's beside the point. I'm not trying to convince you to be religious or, join a religious group or anything like that. But what we want to recognize is the importance of religion in people's lives. The role of spirituality serves a very important purpose. And so it is the recognition that there are things that we will never know. We don't know what happens after death. Probably, maybe nothing, maybe something, but it's not for us to say, particularly in a healthcare setting for someone else. So spirituality describes our orientation to these unknown and unknowable things. Now, the thing about religion and spirituality and religiosity is that even fatalism, which is, as the book describes, the belief that things are happening according to fate or some external whatever order, they can decrease uncertainty. It may not increase our agency to believe in, say, like a higher power, but it can reduce people's uncertainty. And when it comes to things that are terrifying and uncertain, such as death, that can help, right? So we know that religion serves that purpose. Spirituality serves that purpose for a lot of people. And that's important to keep in mind if we are healthcare providers or if we are just trying to support someone in a tough situation and avoiding those kinds of situations like mocking, right? And maybe it would be tempting to try and if you're really atheistic, you may be tempted to rely on non-religious terms to try and comfort people. But if people are religious, then that's probably what they're going to want, right? So we could think about the role of secularism in coping as well. And I don't have a whole lot of solid answers here. There's not many to be had. I'm not an expert in death and dying communication, but we can take some lessons away from other interpersonal communication as well. So what is the role of secularism in coping? Well, there's a lot in common with secularism, with religion and religiosity in terms of the cognitive processes we're going through in our brains. Both require faith in external things, which, as we've said before, can reduce uncertainty. Maybe if people are atheist and don't believe in an afterlife, that can bring them some comfort as well. You never know. But things like nihilism rarely help, where we just say nothing matters and everything, that's not going to help someone who's experiencing emotional distress. And I think there's a very specific reason for that. Nihilism being the belief that nothing matters and it's all pointless. Well, if we are trying to use that to comfort someone, not that you ever would, but the reason that wouldn't work probably has to do with the same reason of it's not great to invalidate someone's emotions. If someone is experiencing extreme emotions and you say, oh, you're overreacting, that doesn't make them feel better. It makes them feel silly or foolish, but not better. So it's important to recognize those limitations when dealing with tough topics such as death. There's also, the book has this interesting discussion of transcendent experiences These are also known as dissociative experiences. I mentioned them earlier in the lecture in relation to drug use, whether it's therapeutic or recreational or whatever. But transcendent experiences can, well, when we do research on transcendent experiences, we see some common themes. For one thing, people tend to feel when they dissociate from their individual identity, they tend to feel more of this holistic identity, a oneness with the universe, kind of a cosmic apotheosis kind of thing. Oceanic boundlessness is a term that has been coined to describe those kinds of transcendent experiences. But what we're talking about is dissociation. So that means that we stop feeling as much like this little tiny little person on Earth. We start feeling more at one with the universe. And so there's research that goes into this. Some people can take a lot of comfort from that kind of dissociative overarching meaning that is derived from transcendent experiences. So that can be a source of comfort. Am I telling you to go do drugs? No. But what I'm saying is that there are those transcendent experiences. We can compare this to dream states. On the edge of sleep, DMT, which is a popular recreational drug, is a concentrated form of a natural hormone that your body produces, particularly while dreaming. So dissociative states are actually common experiences to human beings. When we sleep and dream, that is a dissociative state. Right? And so perhaps there's comfort to be had there. That's about all we can really say about it right now, but keep that in mind. People do derive comfort from that. If you're going through a great deal of stress, feeling more cosmic oneness can be helpful, but also relying on those themes, depending on them for comfort, can be useful as well, or just considering those kind of things can be interesting for us. So not really sure exactly what my point is here, other than recognizing that there's a lot of different ways with dealing with the unknown. But what can be really helpful is basically anything that helps us reduce our sense of helplessness and uncertainty. Whereas believing in higher powers might not reduce our sense of helplessness, it can reduce our sense of uncertainty and thus stress in situations. End-of-life experiences. Now, tying that theme to healthcare, well, this is a whole area that it is a whole area of study, and I think that we as a culture are getting better at dealing with things like death and dying, and there are whole professions devoted to this. We will need to continue to confront the taboo of things like death and dying, but that's nothing new. But the textbook raises this interesting question of, is there such a thing as a good death? And I think it's an interesting consideration. There's one quote at the beginning of the chapter, I believe, where it's like, well, Mario was feeling good about a lot of things, and in some ways, his terminal diagnosis helped him, made him feel better about his existence, and it kind of raises that question of, is there such a thing as a good death? And we could follow it up with a more callous question. It's like, well, if you've got a terminal illness, does it really matter, right? We could be nihilistic about it, but at the same time, we could also be philosophical about it and say, how is that different from everyday life? You never really know when you're going to die, and maybe it's best not to wait until you've got a terminal illness to start thinking about living a good life. So what would a good death look like, though? We could ask ourselves that question if you think that there is such a thing. But regardless, well, the way we are dealing with people who are terminally ill are often dealing with these kind of things. Often hospice care is part of this, and later end of life. This is like live-in care. My grandmother had hospice care as she was suffering from dementia until her death. Not sure it made much of a difference for her, but it wasn't really for her at that point because she wasn't really all there. That was more for the family, my aunts and uncles who were struggling with it. And I think that the hospice care did help. That helped them feel like everything was being done to help her be comfortable as she approached the end of her life. Hospice care is focused on effective coping. It can bring people together and it can help overcome fears. That is the focus of hospice care, and part of the philosophy is on having a good death. But much like a funeral is not really for the person who died, it's for the people who survived. Hospice care is along those lines too. It's drawing those connections between the living and what comes after that. And it can reduce people's suffering, reduce their uncertainty, and help us overcome our fears. Now, additionally, the textbook mentions an important vocabulary word here. Some of this stuff is for healthcare providers, but we can also take lessons from it as individuals, just living our day-to-day lives. There's this idea of an advanced care directive, and that's good for you to know as well, just because you're probably going to encounter stuff like this, regardless of where your life takes you. But an advanced care directive is something that, for situations when individuals cannot communicate their wishes directly. And so that happens when people know that they're approaching the end of their life and they have specific prescriptions and recommendations that they would like in terms of whether they would like to be resuscitated. There's such a thing as a DNR, or do not resuscitate order, so that when people approach the end, the doctors know how much care to give to those individuals. And so that's what an advanced care directive is for. It is documentation which guides care when the individual is not able to, for everyone's sake, right? People who are in distress, including loved ones and family members, may not be thinking very rationally, may not be able to feel like they can make decisions. And again, this is another way to reduce uncertainty and increase agency. Establishing an advanced care directive when you are terminally ill can help you feel like you have control over your life, and that can help as well. Now, let's wrap up this cheery little discussion for tips for delivering bad news. I know this has not been the most uplifting conversation, but hopefully we can get something out of it. Even if you're not a healthcare provider, there may come a time in your life where you have to deliver bad news. My brothers had to tell me my grandparents died, things like that. And there are better ways to do that than others. So here are some tips. These are mostly tailored at healthcare professionals, but I'm sure you can take something away from it as well. The first one I think is probably most important. Build caring relationships in advance. This is a tip for the healthcare professionals, but I feel like it's worth me talking about it for you now, just on an interpersonal level. So sometimes people feel this impulse to avoid their emotions or be an island or a lone wolf or something, and our culture does encourage that kind of stereotype, that kind of persona, and particularly in men. I guess the only advice I have here is don't waste time with that. Don't waste time trying to be a lone wolf. And the reason for that is that vulnerability is only a problem in toxic relationships. So rather than avoiding relationships entirely, maybe just cut out the bad ones. If you have unhealthy relationships that don't make you feel good and don't make you feel supported, you are under no obligation to stay in those relationships. If you have trouble with vulnerability, maybe that can help you out a little bit. Recognize that there are people who care about you. They may make mistakes, but we want to do our best to build caring relationships in advance. In the case of healthcare, this applies for doctors in terms of trying to get to know patients, be part of their narrative, and all those wonderful practices we talked about in the past. Next, if you have to deliver bad news, odds are you're going to need to request time to do so, whatever it may be, but it's good to let listeners know in advance that the news is not good. That can help them prepare for the blow, reduce some of the shock. It's also important to invite support of others if that's an option, so that people can have their social support when they need it most. It's important to talk in a quiet and private place. Avoid semi-private places for fear of whatever, but this can help us reduce the layers of uncertainty and distraction. It's hard to deal with bad news when you're distracted by other people's perceptions and attributions, and the less private the place is, the more of those there's going to be, right? So try to minimize the layers of uncertainty and distraction and talk in a quiet, private place. Tell the truth and avoid jargon and or euphemism and or medical terms, all those things. Try not to beat around the bush too much. Don't be insensitive, but the other tips should take care of that. It's important to tell people the truth so you don't give them false hope or more apprehension. The more unclear we are about what's happening, the more people can read into it, and that can be a problem. Acknowledge and legitimize listeners' emotions. Again, much along the lines of don't tell people they're overreacting, don't tell them to react more, whatever it may be. That can all make people feel annoyed at best and helpless at worst, or just silly, and that's really not what we're going for. So saying things like, I know this is really hard for you to hear, that can, even something like that can help, but legitimizing emotions as opposed to dismissing them is always the better bet. Take cues from the listener as well, right? So you might have to kind of follow their lead. I don't mean like if they're throwing a tantrum, then you throw a tantrum too, but What we mean by that is not imposing a reaction upon them. So treating them like, oh, yeah, this is really sad. Like that's not really what we're going for. You should follow their lead. Let people have their own response to things. Showing genuine caring and empathy is helpful too. Some people respond better to affective care, but even just a little bit of human touch, a hand on the shoulder, can make a huge difference. Be aware of personal and cultural preferences. So refer to number 1 here, the building caring relationships in advance, but this directive is mostly commenting on cultural differences. In some cultures, it's unlucky to talk about bad news directly, things like that. And so the best way to know that is to develop relationships with individuals on the front end. Offer support. Offer resources. If you're a doctor, perhaps this is directing people towards therapy or whatever that can be done. You get the idea here. Be ready with options and plan of action. So people like to have a next step that helps them focus their energy and increase their agency. And of course, schedule a follow-up visit or conversation as necessary. This mostly applies to doctors, but it does help if you are not a doctor and you're find yourself in the situation to reassure people. This shows your support, right? Hey, you want to talk? Why don't we can talk about this again? Whatever it may be. That's another way of establishing that support for people so that they know that they can have it if they need it. Well, I know this isn't the most uplifting conversation, but hopefully we've contextualized it enough to make it useful to you and hopefully better prepare us to deal with these difficult topics going forward. Thanks for your time as always. Have a great day, and I'll see you on the next video for something perhaps a little more cheerful.